Okay, hi, my name is Genevieve Coy, and this is my University of Kentucky MLS 461 microbiology case study. A 59-year-old white male was found down in the woods. He has a history of alcohol abuse and depression, and the only other information the family was able to provide was that he lives alone in a cabin in the woods. He was intubated on the ambulance ride over due to his incapacitated state he was found in. Upon arrival to the hospital, they took his blood pressure and his heart rate, and they both were normal. However, he did show a slightly prolonged QRS interval on his EKG. He also presented with a decently high fever of 103.5. And due to this patient's history, they immediately sent out for a urine drug screen, as well as a serum alcohol, acetaminophen, and salicylate level. The urine drug screen did come back positive for amitriptyline, venlafaxine, and ketamine. However, amitriptyline and venlafaxine are listed as his current medications on his patient profile, and ketamine was given to him in the ambulance ride prior to intubation. So some of the initial lab findings show a slightly decreased white blood cell count, decreased platelets, an increased INR, and some increase in his liver enzymes. So we're currently looking at a slight leukopenia, thrombocytopenia, possible increase of hemorrhaging, as well as some elevation in liver enzymes. We did also perform a CT scan of his abdomen, head, pelvis, and chest. And the chest CT came back showing basilar consolidations, which are essentially when lung tissue gets filled with fluid instead of air. This is often associated with bacterial infections as well as pneumonia. So we are showing some sort of possible damage to his lungs in addition to the leukopenia, thrombocytopenia, and liver enzyme elevation. The initial diagnosis thoughts on this patient are a possible antidepressant overdose. So they immediately started him on sodium bicarbonate to counteract this. The other thought, due to his mental incognition, is possible meningitis. They performed a lumbar puncture and sent out for a meningitis encephalitis panel. And they also sent out for an anaplasma and Ehrlichia PCR to the reference lab, since he lives in the woods and was found down in the woods. And due to the urgency of a diagnosis of meningitis, they immediately started the patient on acyclovir, ampicillin, ceftriaxone, and vancomycin to combat any of the usual meningitis and encephalitis pathogens. So the results of the CSF came back a day later, and they showed an increased white blood cell count, drastically increased protein, and actually a fairly normal glucose. Oftentimes in a bacterial meningitis, you will see a decrease in the glucose. However, that's not the case with this patient. All things considered, it is still pointing towards bacterial meningitis. And however, the meningitis encephalitis panel came back negative for all of the usual pathogens, and the culture also came back negative. So due to the severity of the patient's condition with the leukopenia, thrombocytopenia, as well as being found down in the woods and his history of living in the woods, they did decide to start him on doxycycline at this point, just in case that any of those tick-borne illnesses came back positive. So ultimately, 8 days after admission, the reference lab PCR came back positive for Ehrlichia chaffeensis. So a little bit more about this. It's a gram-negative coccobacilli and an obligate intracellular organism. It's the etiological agent behind human monocytic ehrlichiosis, and it is transmitted by the Lone Star tick. This condition is commonly seen in the southeastern and south central United States, and the initial symptoms are flu-like with fever, headache, fatigue, and muscle aches. However, when left untreated, it can progress to some pretty severe conditions, including meningoencephalitis, acute respiratory distress syndrome, septic shock, and or multiple organ failure. It can also cause leukopenia, neutropenia, thrombocytopenia, and elevated liver enzymes. So in this patient's case, we have already seen that he is presenting with leukopenia, thrombocytopenia, as well as the elevation in liver enzymes. He's also presenting with the meningoencephalitis and some possible damage to his lungs. So the way that this bacteria works is it primarily infects your mononuclear phagocytic cells, so your monophages, your monocytes, and your macrophages. They multiply in the vacuoles to form clusters known as morulae, which you can see in the picture to the right. If you were to perform a blood smear on the patient, these show up about 5 to 7 days after infection. And they form when the bacteria enters the macrophage or monocyte. It actually secretes proteins that allow it in and initially block your host's normal responses. Ultimately, it has been linked that an overproduction in the tumor necrosis factor alpha by your CD8 positive cells contributes to a higher incidence of organ failure and more severity of the disease, as well as fatalities. So for this patient, luckily, they started him on doxycycline on day 2, so pretty early. And after 24 hours on the medication, the patient was awake and responsive, and he was able to be taken off of ventilation. At day 5, they finally discontinued the other medications as he had continued to show improvement with the doxycycline, and the meningitis as well as encephalitis panel had come back negative for those other pathogens. And ultimately, after 14 days on the doxycycline, the patient was able to make a full recovery. So just some last thoughts in conclusion. So the meningoencephalitis is not a super common condition with Ehrlichia chaffeensis cases. However, it is still a possibility with the progression of the disease if left untreated. Luckily, in this person's case, they were able to identify and immediately suspect a tick-borne illness and start him on the doxycycline. Otherwise, it could have been fatal for this patient. So this case was actually from the University of Kentucky, the Chandler Medical Center. And just a last thought, go out in the woods, everybody make sure and use insect repellent. So hopefully none of us end up in a position like this.